So we are done with the breeding, we are done with housing, we are also done with feeding as chicken management activities, which are essential in production. But also disease, parasite, and predator for chicken, in chicken can also reduce, it can also reduce production, be it in broilers as well as even in layers. So meat production can be lowered, as well as even egg production can also be low if they are attacked by diseases, parasites, even predators. So it is important to identify these diseases which attack chicken, to identify the parasites which attack chicken, and also predators which prey on chicken, so that we can know how to control them in order to boost chicken production. If we say a disease can be defined as any alternation in the state of the body of an animal or of its organs which interfere with its proper functioning. So most of the times a disease will lead to malfunction of the body. If that is the case, it means production somehow will also be affected. So disease infection in an animal body is detected by the outward visible signs. So we are going to identify some of the diseases. Also, we're going to also look on the signs and symptoms of each and every disease. So diseases can be a limiting factor in chicken production, as they cause considerable losses in case of an outbreak. And most of the times, diseases which they are caused by pathogenic organisms. Good examples of these pathogenic organisms are bacteria, viruses, protozoa, and fungi. Therefore, we can classify the diseases of chicken or poultry in several categories. Uh, First of all, we can classify chicken diseases or categorize them based on the causal organisms. For example, those diseases which are caused by virus, they are known as viral diseases. Good examples are smallpox, Newcastle, and Gumbolo. While there are other diseases which are caused by protozoa, therefore we can call them protozoan diseases. Good example of such a disease is Coccydosis. We can also have other diseases which are caused by bacteria, therefore they are known as bacterial diseases. And good examples of bacterial diseases in poultry are for typhoid and for cholera. Though there are some of the diseases which are caused due to nutritional, physical, chemical, as well as congenital or heredity. So there are some of the diseases which will come due to chemical or poisoning, physical, as well as even nutritional. Let's now look into details in each and every disease which will attack poultry. The first one is this disease which is called Newcastle. Newcastle disease, sometimes it is also known as pest or fowl plague. This is highly contagious and infectious disease in poultry caused by virus. So the disease is caused by virus. And the virus most times is very resistant to unfavorable environmental conditions and can survive up to 5 to 6 months in poultry manure, in bones of dead birds, and even in eggs. But most times it is transmitted through inhalation and ingestion of contaminated feeds, discharges from the nose and mouth, droppings, and eggs from affected birds. So that's how this virus can be transmitted. How can we know that our poultry or our chicken have been attacked by Newcastle? So there are some symptoms. For example, nozzle discharges, forcing the bird to shake the head in order to clean them is one of the symptoms. Apart from that, you profuse green diarrhea. So green diarrhea can also be another symptom of Newcastle. And if you find them coughing or sneezing, it's also another symptom of Newcastle. So due to coughing and sneezing, that can cause nasal discharge, as already mentioned above. Apart from that, birds walk with a staggering motion since the nervous system is affected. They do not walk properly, and this may lead to paralysis of wings and legs. Another symptom is dropping of wings. Also, closing of eyes almost all the time as a result of swelling around them. So there are some swells around the eyes. That's why most of the times they will look like they are closing their eyes. Another symptom is walking backwards and cycling motions. Twisting of head and neck is also another symptom. And lastly, gasping for air and producing a harsh rasping sound during breathing is also another symptom. So these are some of the symptoms which may appear in chicken once they have been attacked by Newcastle. Even though it is very, very difficult to control the diseases which are caused by virus, but somehow we can control, more especially prevent the disease just by vaccinating the birds at regular intervals. That is when they are 3 days old, 3 weeks old, then 3 months old, thereafter every 6 months. In that case, we can prevent the birds from being attacked by Newcastle. But when they have been attacked by the disease, it is important to destroy the whole flock in case of an outbreak. Otherwise, the spread might be viral. Imposition of quarantine may also help. Once some of the animals or in an area there is an outbreak of Newcastle, quarantine may help. Quarantine may help so that you observe them. They should be under observation. You're looking if at all they will be showing some signs or symptoms of the disease. If they show some signs, then you kill the animal to prevent it spreading the disease. We can also prevent just by ensuring proper farm hygiene. Uh, uh, you put the footpath at the door of poultry unit. So proper farm hygiene can help to prevent the disease. Just because we're saying that the virus can stay in the droppings maybe for some weeks. So if the animals they consume the droppings from the infected animal, it means they can also catch the disease. So farm hygiene is very, very essential. Apart from that, disinfecting poultry house before bringing in new stock. You never know the stock which was in the house, maybe one or two birds had the disease. So to prevent that, you make sure that you disinfect the poultry house before bringing in new stock to prevent the new stock from catching the disease. Apart from that, obtain stock from reputable sources, more especially the hybrid species which we raise. It is important that you buy from the reputable sources, just because some of those sellers in their herd in their flock they might have some birds with the disease. So to prevent that, at least you should only buy from those sellers of which you know that their birds are clean without the disease. Apart from that, proper stocking rates in the poultry house can also help to prevent the spreading of the disease. If there is overcrowding in the poultry house, it will be easier for the disease to transfer from one bird to another, just because the birds may be pecking from the droppings from the affected birds. So to prevent that, at least make sure that there is proper stocking rate in the poultry house. Frankly speaking, there is no effective treatment for Newcastle disease. There is no effective treatment for Newcastle disease. As I've already indicated that most of the diseases which are caused by virus, it is very, very difficult to control them, but rather we can prevent. Smallpox is also another infectious disease which affects mainly chicken, turkey, pigeon, and other classes of birds. And this disease is caused by virus again, smallpox virus, which gain entry into the body system through inhalation. Once they inhale, they may inhale together with the virus. Apart from that, direct contact and biting flies can also be one of the way how the animals can catch the disease. So most of the times the disease can easily spread if there is presence of biting insects such as mosquitoes, lice, biting flies, and ticks. Just because they can these are carriers. These are carriers of the smallpox. Also, presence of wounds will also act as an entry point for the virus. Presence of wound may also act as an entry point for viruses. So make sure that if the birds have some wounds, you treat them to prevent the viruses to enter into their body. Overcrowding can also be another cause of the spread of the disease, not forgetting unhygienic conditions. What are the symptoms of fowlpox? Widespread lesions on the skin, wattles, legs, veins, feet, and even under the wings is one of the symptoms of fowlpox in chicken. And these lesions start as discolored spots on the skin, which later on develop into swellings. And the swellings become fluid filled and later form pus. They will later form pus. But upon healing, they'll still leave or they'll still form some scabs. Another symptom is the presence of lesions even inside the mouth and throat mucous membranes. Apart from that, watery discharges from eyes and nostrils in the early stage of infection. So once they have just been attacked by the disease that is fowlpox, the early symptoms are watery discharges from eyes and nostrils. Further, difficulty in breathing and swallowing is also another symptom of fowlpox. And also loss of appetite. You find out that your bells they are not pecking on the feeds you have provided. With them. And the last symptom, more especially in layers, is reduction in egg production. So another symptom of fowlpox in poultry is a reduction or fall in egg production. If at all per day the chicken was laying 2 or 3 eggs, it now reduces maybe to 1 or even 0 per day. How can we control the disease fowlpox? Fowlpox, as already mentioned, is also caused by virus. Therefore, it is also very, very difficult to control the disease. It is very, very difficult to control the disease. There is no specific drug which will help to eradicate the disease, but rather prevention is possible. So these are some of the prevention measures, like carrying out regular vaccinations. Apart from that, once you find out that some of the chicks are showing some signs or symptoms of the disease, just isolate the sick birds to prevent the spread of the disease to healthy birds. Observe a hygienic condition in poultry house is very, very important also if you want to prevent fowlpox from spreading from one bird to another. Another remedy can be burning and burying dead birds. Once the birds have been attacked by the disease, more especially the dead ones, it is recommended that you bury them as well as you can burn or bury them, so that there should be no contact between that dead body which was attacked by the disease with the healthy birds. Once they come to contact to the infected birds or even their dead bodies, definitely they may catch the disease. In terms of treatment, we can only treat secondary infections. For example, lesions, just by applying iodine, on the vesicles. So once, as already mentioned, one of the symptom of fowlpox is formation of lesions. formation of lesions. So we can just treat those lesions just by applying iodine. Another disease which will attack chicken is what we call gumboro. Sometimes it is known as infectious parasitic disease. This disease affects mainly poultry aged between 3 to 6 weeks, not above 6 weeks, and it is caused by virus as well. In terms of transmission, it can be transmitted through feces and other contaminants, that is feeds and beddings. What are the symptoms? How can we know that the animal or the bird has been attacked by gumboro? Some of the symptoms are as follows: white diarrhea, the feces with some white color. Apart from that, soiled veins and feathers. You find that there are some soils on the veins as well as even the feathers. Of course, it's due to diarrhea, and once they fall down, then the feathers, the soil will be all over the veins as well as the feathers. Apart from that, birds exhibit an coordination of body system and also pecking of vent due to irritation. So the vent, they'll be irritated with the vent which we are saying that is soiled, therefore they will start to peck on the vent. Apart from that, inflammation of the cloaca. So you find that the cloaca may be swollen, and there is also immune suppression due to the predisposing birds. And most of the times, the animals which have been attacked by, or the birds which have been attacked by gumboro, they can easily catch coccidiosis. This is of course another disease which we're going to discuss into details. So we're saying that the birds which are been attacked by gumboro, they can also be easily attacked by coccidiosis. And lastly, another symptom is that swollen bursa of fibrous gland above the vent of the bird. This comes as a result due to pecking. We are saying that the bird start to peck on the vent, so that can lead to the vent to become swollen. How best can we control the disease? We can control the disease by providing them with regular vaccination through the eyes and also in drinking water, so that they should take the vaccination orally. Apart from that, observing hygiene. So observe poultry house hygiene is also important, since we are saying that the virus might be in the droppings. So if you remove the droppings now and again, cleaning the house, disinfecting the house, that can help to prevent the spread of the disease. Overcrowding is also one of the thing which can lead to the spread of the disease. So you should have the right population of bird per house. We mentioned earlier on when we are looking on housing what can be the adequate space per bird. I think we did it even in terms of measurements. Killing, burning, and burying infected birds can also help to prevent the spread of the disease. As already mentioned, the diseases which are caused by virus, they are very, very difficult to control or treat them. So that's why preventing can help uh, uh, to spread the disease. So that's why we're mentioning of killing, burning, and burying the infected birds to prevent the spread of the diseases from infected ones to healthy ones. The only thing we can do is just by giving them antibiotics, multivitamins, and fluid administration to the affected birds, to those birds which are affected. Coccidiosis is another disease which will attack birds, and this is caused by protozoa. It is caused by protozoa. To be specific, the name is Coccidia. Coccidia. That's why maybe the name of the disease is coccidiosis. This coccidia is host specific, meaning chicken can only contract the disease from chicken, whereas ducks are contracted from ducks, among others. So if the disease maybe have attacked the duck, that duck cannot spread the disease to the chicken, but rather we're saying that this coccidia, the protozoa, is host specific, the same animals. And the virus most of the times will attack the alimentary canal of the bird, especially the small and large intestines and even the liver. The main factor of the spreading of the disease can be overcrowding in livestock housing. If there is overcrowding, most of the times it will be easy for the disease to spread. Symptoms of coccidiosis. One of the symptoms of coccidiosis is bloody diarrhea. When they are the droppings from the animals which are affected by the disease, their droppings have some blood. So bloody diarrhea is one of the symptoms. Apart from that, the birds may have laphod feathers. Even the birds will appear dull and sleepy. So most of the times the birds which have been attacked by coccidiosis, they become very dull and sleepy. And most of the times there is sudden death in birds, more especially young birds. There is sudden death in young birds. And another symptom which is dropping wings. So these are some of the symptoms which the farmer might know that the birds have been attacked by coccidiosis. What can be some of the preventive measures? Number one, maintain hygiene in animal and poultry houses. Hygiene condition is very, very important in as far as controlling or preventing chicken from catching the disease is concerned. But we can control the disease just by giving some drugs. For example, prophylactic drugs will help to control the disease. A good example of prophylactic drugs are coccidiostans. So you provide these coccidiosis in the food or even drinking water for poultry. But if at all maybe the animals have been attacked by the disease, isolation may also help. So you isolate affected animals so that the healthy ones should not be affected as well. And maintaining appropriate numbers in animal houses will also help to prevent the disease. As already mentioned, overcrowding can be one of the factors of the spread of the disease. So there are also other drugs which will help to treat the disease. For example, we have fulazolidone, prolium, as well as coccidiosis. These ones, they will help for curative treatment. For typhoid is also the disease. This disease most times affects adult birds and primarily chicken. The disease is caused by bacteria. So the bacterium and so-called Salmonella gallinarum. And most times it is transmitted through eggs and droppings. It is transmitted through the eggs and droppings. These are some of the symptoms: dullness. The animal becomes dull. And there is also the problem in terms of respiratory. So respiratory problems is also another symptom. Yellow-green diarrhea is also another symptom. From their droppings, you find that it is yellow-green in color. Dropping of wings and sleepy eyes can also be another symptom. And whitish pasting of veins, you find out that on the veins you find some whitish color. So it's also another symptom that the animal have been attacked by for typhoid. And the birds are huddled together near a source of heat. In short, maybe fever can be also one of the signs. Pale wattles and combs can be another symptom as well. And most times the birds may die within 3 to 6 days. Once they have catch the disease within 3 to 6 days, if they are not treated, they may die. So birds die within 3 to 6 days. Control measures. It is possible to control the diseases which are caused by bacteria. We can treat those animals, the birds which have been attacked by bacterial diseases. So regular vaccination of the bird may help to prevent the disease, and killing all the affected birds and dispose them off can also help to prevent the spread of the disease if you are not having proper drugs. Maintaining cleanliness in the poultry house may also help to prevent the spread of the disease. Remember, we're saying that these bacteria, they may be found in droppings as well as eggs. So removal of eggs as well as even removal of droppings may also help to prevent the spread of the disease. So eggs for hatching and day-old chicks should be obtained from reputable sources. Otherwise, if you may collect them from anywhere, you may end up collecting the eggs which are already affected by the disease. The drugs which can help to control the disease is sulfur drugs. So provide sulfur drugs in poultry feeds or drinking water to prevent the disease. Another disease which is also caused by bacteria is what we call fall cholera. Fall cholera is another disease which will attack chicken, and it is caused by bacteria. This fall cholera disease sometimes can also be known as pastorelazine. And the mode of infection or transmission, most of the times for cholera is a highly infectious disease, and it will spread very fast. This disease can spread very fast, and it can be spread through the following ways: direct contact between infected birds and healthy ones. Wild rodents and birds can also be a source of infection, and infection from contaminated feed bags, feeding and draining equipment, as well as even human clothing. They may also introduce some bacteria into the farm. There are two types of fall cholera. There are two types of fall cholera, and these are acute type and chronic type. Acute type, the disease takes a short period from infection to when the first symptom appears. Usually it's within 1 to 3 days. Then the symptoms will appear. So the disease develops fast, and some birds may die just within hours from infection. It may result into a huge loss just because as a result of loss of large numbers of birds. Some symptoms of this type of fall cholera is that there is fast and difficulty in breathing. They will breathe fast if at all they are managing to breathe, but also they will experience some difficulty in breathing. And green diarrhea is also another symptom of this type of fall cholera, which is acute type. Rate of respiration may also increase. Wattles and combs are pale red, but later turn dark red once they are at advanced level stage of the disease. And it will reduce laying of eggs. It reduces laying of eggs, more especially in layers. And in breeding stock, mating is reduced, hence reducing fertility as well as even productivity of the flock. So that's on acute type. On a chronic type of fall cholera, the birds take long time to show symptoms of infection. You may feel like maybe your birds are healthy just because the signs will take time before they show off. So there are only a few losses. But some of the symptoms of chronic type of fall cholera is running nostrils, and the face, eyes, as well as wattles may become swollen, especially in males. Some symptoms may also appear on postmortem for both, of course, for both acute as well as chronic type. There is also enlargement of liver and spleen. Once the bird have been attacked by this fall cholera, there is enlargement of the liver and spleen. If that is the case, it means this may lead to malfunction of the liver as well as spleen. hemorrhage of the heart and the presence of fluid in the pericardial membrane is also another symptom. And you found there is also hemorrhage of the intestines. It is possible to treat for cholera, be it acute as well as chronic. It is possible to treat the disease just by administering antibiotics, suitable antibiotics. For example, uromycin in drinking water, and even tetracycline can also help. Some antibiotics can be administered through infection. For example, chlorphenicol. Chlorphenicol can be administered through infection. How we can minimize the outbreak just by killing affected birds, burying them, as well as even burning them, so that the healthy ones, the healthy birds, should not come into contact with the infected birds. Proper sanitation may also help to minimize the spread of the disease. And also, more especially when replacing the stock, the new stock in the house, you make sure that there is proper sanitation. For example, you make sure that the equipment should be well cleaned. They should be disinfected at least, and make sure that once you have cleaned the equipment, disinfected the area, then that house should be in use maybe after a minimum of 2 months. Routine vaccination should also be done regularly, more especially once they reach 10 to 14 weeks old.
Simutaya nthawi yanu kufunafuna maphunziro muzakhala wotumidwa moyo wanu wonse. Ngati simuphunzira anthu azingokutumani, ajala kalime, ajala kuchwe manyazi, ajala katende yanti, ndipo anthu ophunzira wandi wotumanso kwambiri. Ndiye ngati simuphunzira, skulu akuyikirani apa mukhala otumidwa.